Hey everyone, and welcome back to the Deep Dive. You know how we love to, take a deep dive into some fascinating topic, healthcare tech, whatever's caught our interest.
Right. We sift through all the research, reports, articles, the whole shebang, so you don't have to.
Exactly. And today, we're zeroing in on something pretty crucial, especially for all you healthcare pros out there, nurses in particular.
We're diving headfirst into the world of AI, but not just AI in general. AI specifically tailored for nurses.
Because, let's face it, your job is demanding enough.
You're on your feet all day, dealing with patients, mountains of paperwork, you name it. So we figured, why not explore how AI can actually make your lives easier and improve patient care in the process?
Now, I know AI can sound a little intimidating, maybe even like something out of a sci-fi movie.
Sure, but the reality is AI is already making its way into healthcare, and it has the potential to be a real game changer.
We're talking about things like AI systems that can spot things on X-rays that even the most experienced doctors might miss.
Or think about AI assistants that can handle those routine patient questions, freeing you up to focus on the more complex cases.
Before we get too ahead of ourselves, let's take a step back and look at the big picture, shall we? The research we've been digging into lays out three main objectives when it comes to AI in nursing: knowledge, perspective, and values.
Let's break those down, starting with knowledge. This is all about understanding the basics. How does AI actually work? What are its capabilities? And most importantly, how is it being used in healthcare right now? We're talking practical applications here.
Right. Things like using AI for diagnostics, streamlining workflows, even managing patients. But then there's the perspective piece.
That's where things get really interesting, because perspective is all about shifting your mindset, seeing AI not as a threat, but as a powerful tool.
A tool that can help you do your job better, more efficiently, and with hopefully a lot less stress.
And that brings us to the values part.
This is all about ensuring that AI is used ethically and responsibly in a way that supports nurses, not replaces them.
Absolutely. We want to be clear about that. This isn't about robots taking over the nursing profession.
It's about empowering nurses to provide even better care.
Right. It's about letting AI handle the routine tasks so you can focus on what truly matters, your patients.
So with those objectives in mind, let's dive into some specific examples. The research talks a lot about AI in diagnostics.
Ah, yes. Diagnostics. This is an area where AI is already making a huge impact. Think of it as having a second set of, super-powered eyes, analyzing scans and images in ways that humans simply can't.
Like catching tiny details that might be missed otherwise.
Exactly. And this can make a world of difference when it comes to early detection and ultimately better patient outcomes. There's this incredible case study about an AI system that can detect tumors in mammograms, leading to much earlier breast cancer diagnoses.
Wow, that's amazing. I mean, that kind of early detection can be life-saving.
Absolutely. But AI isn't just about finding problems, it's about making things run smoother, too.
Yeah, like cutting down on all that paperwork.
Oh, tell me about it. I think every nurse has spent countless hours drowning in patient notes and administrative tasks.
And that can lead to burnout, which is a huge problem in the nursing profession.
No doubt about it. But imagine an AI that can summarize pages of patient notes in seconds, send reminders for follow-ups, even help allocate hospital beds more efficiently.
It's like having a super organized assistant, but one that never gets tired.
Exactly. And that means you have more time and energy to focus on the human side of care.
Okay, so we've got AI helping with diagnostics, making workflows smoother. What's the last big area we need to cover?
Well, that would be patient management. This is where things like virtual health assistants and remote patient monitoring come into play. Think about it. Patients can have access to care 24/7.
It's like having a doctor in your pocket.
In a way, yes. Plus, AI-powered wearables can keep tabs on a patient's vital signs even when they're at home, sending alerts to the care team if something seems off.
So it's all about being proactive, catching potential problems before they become serious.
Exactly. And let's not forget about chatbots. Those AI-powered assistants can answer common questions, provide educational materials, even guide patients through pre-op or post-op instructions.
All without a nurse having to lift a finger. That's pretty impressive.
It is. It's about using AI to improve communication, provide support, and ultimately lead to better outcomes for everyone involved.
Okay, so before we dive even deeper into all of this, and believe me, there's a lot more to explore, the research actually highlights some real-world success stories where hospitals and clinics are already using AI and seeing incredible results.
Oh, absolutely. We came across some fascinating case studies. Like one hospital implemented an AI system for early sepsis detection, and they saw a significant drop in mortality rates. It's remarkable.
Another clinic started using AI assistants for those routine patient questions, and not only did it free up nurses' time, but their patient satisfaction scores went up too.
It's a win-win situation. But we also saw how AI can make a difference on a system-wide level. There's this case study about a healthcare system that used AI to manage patient flow, which led to better bed allocation and, get this, shorter wait times in the ER.
Now, that's something that I think we can all get behind. But all this talk about AI, diagnostics, workflows, patient management, it's a lot to take in, right?
It is. So let's take a breath and ask ourselves, how can nurses actually use this information to make a difference in their own bar work? How can they leverage the power of AI to provide even better care?
That's the million-dollar question, and it's something we're going to tackle head-on when we come back after a quick break. But don't worry, we've got you covered. We've put together a super helpful PDF with all this information, those incredible case studies too, and you can download it absolutely free. Just check the show notes for the link.
See you in a bit. Welcome back. Now, before the break, we were talking about all the amazing things AI can do for nurses.
Like how it can help spot those tricky diagnoses, cut down on that mountain of paperwork, and even keep an eye on patients from afar.
Exactly. But let's shift gears a bit, shall we? Let's talk about how this all plays out in your everyday work as a nurse.
Yeah, the practical side of things. That's what I'm really curious about.
Well, let's start with something every nurse knows all too well, electronic health records.
Well, those things can be a real headache.
You said it. I mean, all those pages and pages of notes, trying to find that one crucial bit of information. It's like searching for a needle in a haystack.
Tell me about it. So how can AI help with that?
Picture this. You've got an AI assistant that can sift through all those notes for you. It pulls out the key points, flags any potential red flags.
So instead of me spending hours poring over charts,
You can get a quick snapshot of what's important. You're focusing on the patient, not the paperwork.
that would be amazing, especially when you have a ton of patients to see. But what about the actual decision-making in patient care? Can AI help with that too?
Absolutely. This is where something called predictive modeling comes in. It's basically using AI to analyze a patient's entire medical history, lab results, medications, the whole 9 yards.
And then,
And then it helps anticipate what might happen next. It's like having a crystal ball, but one that's based on real data.
so instead of just reacting to a patient's current condition,
You can be proactive. Take steps to prevent complications before they even have a chance to develop. It's like going from playing defense to playing offense, you know?
that sounds incredibly powerful.
Yeah.
But I have to ask, isn't there a risk that the AI could be wrong? At the end of the day, it's still the doctor and the nurse who are responsible for the patient's well-being.
You're absolutely right. And that's something we always need to keep in mind. AI is a tool, not a replacement for human judgment. Think of it like this. Those predictive models give you insights, recommendations, but ultimately...
The final decision is still up to the humans.
Exactly. You, the nurse, are still the one calling the shots, using your expertise and experience to make the best choices for your patients.
That makes me feel a lot better. It's like having a really smart consultant offering advice, but you're still the one in charge.
I like that analogy. It's all about teamwork, AI, and human healthcare professionals working together to achieve the best possible outcomes.
Speaking of teamwork, a lot of what we've talked about seems focused on hospital settings. What about patients who are being cared for at home?
That's where remote patient monitoring takes center stage. Remember those wearables we talked about earlier? The ones that track vital signs? Well, AI can analyze that data in real time and alert the care team if anything looks out of the ordinary.
So even when patients aren't physically in the hospital.
They're still being looked after. It allows for early intervention, which can help prevent those costly hospital readmissions.
And I bet it's especially helpful for people managing chronic conditions.
Absolutely. It gives them more control over their own health and gives you, the nurse, more peace of mind.
Are there any other AI tools being used in home-based care?
Oh, there are a bunch. Think AI-powered chatbots that can answer common questions, provide educational materials, even walk patients through pre-op or post-op instructions. It's like having a 24/7 nurse on call.
That can be really helpful for patients, especially if they're feeling anxious or unsure about something, and it definitely frees up nurses from having to answer the same questions over and over again.
Right. It's all about improving communication and providing that extra layer of support, which, as we've seen, leads to better outcomes for everyone involved.
All this is really exciting stuff, but I have to admit, it's a little overwhelming too. It's like the future is already here, and we need to catch up.
I hear you. Healthcare is changing at an incredible pace, and sometimes it feels like you're trying to drink from a fire hose. But hey, that's why we do this deep dive to help you make sense of it all.
And speaking of making sense of it all, don't forget about that PDF we put together. All the key takeaways, those amazing case studies we talked about, it's all in there. And it's completely free to download. You can find the link in the show notes.
It's a great resource to have as you start thinking about how you can integrate AI into your own practice.
So where were we? We've covered a lot of ground here. AI and diagnostics, workflows, patient management, even home-based care. It's amazing to think about what's possible. But I also wonder if there are any potential downsides to all this.
That's a great question, and it's something we need to be mindful of as we embrace these new technologies.
So we've been talking about all the cool stuff AI can do in healthcare, especially for nurses.
Yeah, from catching diseases early to helping manage patients even when they're at home.
Pretty mind-blowing, right?
Right.
But before we wrap things up, I got to ask, what does all this mean for the future of nursing? I mean, AI is changing things so fast, it's a little, unnerving.
I get it. It's a big question, and honestly, it's something everyone in healthcare is thinking about. But here's the thing. AI isn't about replacing nurses. It's about making you even better at what you do.
So instead of taking over our jobs, AI is actually going to make nurses even more valuable.
Exactly. Think of it this way. All those routine tasks, like data entry and answering basic questions, AI can take those off your plate. That frees you up to focus on the things that really matter.
Like spending more time with patients, providing emotional support, all the stuff that drew us to nursing in the first place.
Couldn't have said it better myself. Plus, as AI keeps evolving, who knows what amazing new possibilities will open up.
Yeah, like what? Give me an example.
Well, imagine AI tools that can help you develop personalized care plans for each patient. Or maybe even predict patient needs before they even come up.
Wow. That would be incredible.
Right. And think about AI helping connect patients with all the resources they need to stay healthy, even after they leave the hospital. The possibilities are endless.
So it sounds like the future of nursing is all about collaboration, working hand in hand with AI to deliver the best possible care.
Absolutely. But that also means nurses are going to need to learn some new skills. We got to keep up with the times, right?
Yeah, like what kind of skills?
Well, it's about embracing lifelong learning. Maybe taking some courses on AI in healthcare, attending conferences, or even just reading articles and, listening to podcasts like this one.
Just stay informed.
Exactly. But it's also about being curious, open to new ways of doing things. The nurses who will thrive in this new world are the ones who are willing to adapt and collaborate with AI to really push the boundaries of what's possible in healthcare.
This has been such an eye-opening conversation. I feel like I have a much better grasp on what AI means for nursing, both now and in the future.
Glad to hear it. It's been a pleasure sharing these insights with you.
Before we go, I just want to remind everyone about that PDF we mentioned. It has all the key takeaways from our discussion, plus those fascinating case studies we talked about.
It's a great resource, and it's totally free. Just check the show notes for the download link.
And on that note, we've reached the end of our deep dive into AI in nursing. Thanks for joining us, everyone. We'll see you next time.